I'm Renee Roth Powers, Doctor of Physical Therapy and owner of Fundamental Motion Physical Therapy and Athletic Recovery. You might be thinking about setting up a standing desk, or maybe you already have one, but you're not as comfortable as you expected. If that is the case, the first step to take, if you haven't already done so, is to watch my video about setting up your standing desk correctly for your individual body to encourage good standing postures and minimize the likelihood of short-term discomfort and long-term pain. But the fact is that even with the best possible setup, your body is going to get tired and potentially fall into bad habits. The human body is genius at finding ways to make standing as easy as possible. But as we'll see, those easy standing positions your body finds are almost never healthy or pain-free in the short term or the long term. We are going to look at some very common poor postures and habits that people tend to adopt while standing and that you may unconsciously fall into as well. It's important to be aware of these easy but harmful posture habits because they can both make your workday miserable and cause long-term changes in your joints and tissues that can cause more pain down the road. So the first thing to remember before we start looking at specific postures that are not good to sustain while you're using a standing desk is that you should really stand no longer than 45 minutes. Why is that? I mentioned it in my video about setting up a standing desk correctly, and now I'm reiterating that that's very important. Your body will assume positions that make it easy for you to stand, but what that does is it overstretches parts of your body. It makes those tissues floppy. They're less resilient. So if you think about overstretching a rubber band and you stretch it to the point where it loses its elasticity and then you let it go, it just sits there sort of, floppy, hanging around. That's what's going to happen to your spine, to your hips, to your neck. And when you move out of that position, after sustaining it for 50 minutes, your body doesn't spring back. You want to transition either to movement or sitting before the 50-minute mark, while your tissues will still respond and they haven't had a chance to adapt to a prolonged position that isn't the healthiest position. The other issue about a 45-minute limit is that your body starts to get fatigued. It starts to get tired. And even though you might think you're standing correctly, gravity starts working on you and you can't sustain that position, that corrected position very well because of fatigue. So absolutely remember to transition to either movement or sitting after 45 minutes. So now let's take a look at some specific postures that you might identify and recognize within your own standing habits. In this first position, hopefully it's quite obvious that this is not a healthy standing posture. This is called sway back posture. And this is a posture that's very common. You might not recognize it in yourself, but other people who know you may look at this picture and say, oh yes, I've seen you stand that way. One way that I illustrate how postural stresses and alignment problems focus stress and compression on one particular area of the body is the fundamental motion straw. And this straw has a bend in it, and you can imagine, if I bend this straw over and over again, one, it's memorized where it's going to bend when a certain movement is applied, and two, this material in the straw is going to break down. You may be focusing pressure and stress on one or more parts of your body that will start to create wear and tear, just like bending this straw over and over again. That's why it's very important that you balance out your posture and your alignment so you're not focusing that stress in one particular area and it's more distributed over your joints, your muscles, and your connective tissue. So we can see here with this sway back posture again that I have in picture one is the shoulders are behind the hips, and where he is bending the straw and focusing pressure is here through his upper back, here through his lower back. You can imagine bending the straw there. He is overstraining the front of the hip and he is overextending or hyperextending the back of his knee. Parts of his body might tolerate this for a period of time. Other parts might be giving up and telling him, we are not happy with this position. So in picture number 2 in the center, if we draw that line, I'm standing with my shoulder behind my hip. Where I am focusing that stress and strain, again, is low back, upper back, front of the hips, back of the knees, and potentially if I have heel pain, plantar fasciitis, what happens in that sway back posture is that all of your weight is back on your heels. So if you have a heel problem, it also changes the line of gravity through your body and puts a lot of pressure through the back of the foot. This is not a position that you want to assume while using your standing desk. You want to recognize if you stand in this position, and you want to get yourself out of it. One way to get out of this position, if you know and recognize that you use the sway back posture, is to just squat a little bit. Push your hips behind you like you're sitting in a chair, and then stand up. And what that does is that helps to bring your hips underneath your shoulders rather than them being swayed forward. So that's a little trick, even if you have to have a chair behind you so your brain can say, I'm going to sit and reach my hips for that chair. That can be a good helper or cue to get you to put your hips underneath your shoulders and let them stay there when you stand up. It's going to feel a little awkward. It might not feel natural, but it will be the correct posture, and you should learn to become accustomed to it. And what I've done in picture 3 is I've just aligned myself so shoulders are directly over hips and lined up right through the foot and ankle. So now there's no sway posture. Now that weight of my body is evenly distributed across my spine, through my hips and pelvis, through my powerful and stable legs, and through my feet. So that's the sway back posture. Now let's look at another common standing posture. So if we take a look at this picture, this is a very common standing position. It's standing on one hip, where basically you just rest your body on one hip and hang off of the connective tissues in that outer hip area. So if we take a look at this curve, that's the hip that this person is hanging off of. And if we think of that in terms of bending the straw, if we pick up the straw and we look at how that stress is generated on the body, right here we're curving and bending the straw, we're stretching that outer layer of tissue, and that's exactly what's happening at the outer hip region as you stand on one hip with one hip sort of swayed out to the side. Where that generates stress is in this outer hip region, and this position often contributes to discomfort that people feel in the outer hip, to a diagnosis called trochanteric bursitis, pain at night, either lying on that side that's painful or lying on the opposite side where the painful hip is on the top as you're lying on your side. This is a very common posture that contributes to that sort of discomfort. The other places that this position really stresses is the knee, because all of your weight is supported on this leg that's acting as a prop, and as well as putting your weight through that standing foot. And then the sneaky place that also becomes stressed in this position is the spine. So what happens is one side of the pelvis drops down, the other side of the pelvis is elevated. This posture will contribute to something called an apparent limb length difference. And that means that the side that you're standing on elevates the pelvis, and it creates a shortness in the muscle tissue. You don't want your spine to experience a bending the straw stress because you're standing with one side of your pelvis elevated and the other side of your pelvis lowered. The key is to distribute your weight over both legs. Oftentimes people have a preferred side for this standing habit. If you try to stand on the hip on the opposite side, it just doesn't feel comfortable. It doesn't feel natural. Your body hasn't stretched its way into it. That's a good thing. We don't want you to become more accustomed to doing it on the other side. We want you to potentially use a support under one foot. In my first video, when I talked about using and setting up your standing desk correctly, I suggested the use of a book or reams of paper under one foot that's between 4 and 6 inches high. This kind of posture would be improved by using something where one foot can rest forward. That keeps the body much more symmetrical and supported. So we're going to take a look at that standing on one hip posture while using the standing desk. And again, we've got our person who finds this position very comfortably with that hip stuck out to the side, all of her weight on one side of the pelvis is lower, one side of the pelvis is higher. We've got stress on the knee, we've got stress on the foot. If we look at me in this third picture, I am standing in that same position while working at a standing desk. This might look very familiar to you. The problem with this is that it, again, stretches the outside of the hip, it drops one side of the pelvis, it elevates another side, and then the other thing we can see from this picture of me standing, and everybody's body is going to be a little bit different, even if they use this posture. You can see that one side of my upper back and shoulder is higher, the other side is dropped down lower because you create this side bend right here at the waist. This is not a great posture. And what you want to do is you want to put your weight like the center picture, so your shoulders are level, your pelvis is level, and you've got equal weight through each foot. One way that you can shift your body around a little bit is you can move your feet wider, you can bring your feet closer together, but you want that position to be symmetrical. You don't want your spine to be shifted, you don't want one side of your body, like your knee, your hip, your foot, to carry too much of your weight and to adapt to that position where you start to get permanent tissue changes. So the third posture that's very important, and it's critical whether you're standing or sitting, is called forward head posture. And what that means is that the head is craned forward, that your head slides forward over the vertebrae, and oftentimes the nose and the chin are lifted upward. People adapt this position in order to see. They feel like they're seeing what's in their field of vision more clearly, and that they have a larger field of vision if they're lifting their head up. This becomes a really bad habit, and the reason why is, again, bending the straw, and bending the straw at the neck. So if you think about someone who's looking forward toward my finger, what happens is the neck creases backward, and we get this very specific bend at your vertebrae. This could be C5, C6, C6, C7, and that part of your neck becomes very mobile. So every time you get into that forward head position, it bends at the exact same place. You start to wear your disc out, you start compressing the nerve roots at that region of the spine. This is something you definitely want to avoid. So if we look at the picture in the center, this person has a crease in the back of their neck right here. And what are they doing? They've got their head sliding forward. Their nose, if we draw an angle, their nose is slightly upward, chin is slightly upward. We've got the head craned forward a little bit, and oftentimes that forward crane comes from a slight roundedness in the upper back. That roundedness is called kyphosis. And we all should have a little bit of natural kyphosis, but oftentimes people get this very exaggerated or very notable curve in their upper spine. And then guess what? The neck is stressed because you lift your nose and chin and your eyes to see what's in front of you. This is, again, a very common habit, and you want to be aware of it. So if we look at picture 3, this person is demonstrating an even more significant kyphosis or curve of the upper back, and we think about bending the straw. Look at this crease in the back of their neck, which is very prominent. Guess what's going to happen every time he puts himself in this position? It's going to crease that spine in the exact same place. Pretty soon he's going to have neck problems. His neck might hurt. He might start to feel numbness and tingling, or something running down his arms, might have sharp muscle type pain, and oftentimes this is where the neck really becomes irritated and you start having changes that are generated from that region. So the head is sliding forward, the chin is lifted, the nose is up a little bit, and that is a posture that you want to eliminate from your go-to postures, your postural habits. The picture in number 1 is a much better position. He has a neutral neck. His ears are located over his shoulders are over his hips, and his hips are over his feet and ankles. We have almost no curve back here, what I would call a very natural curve at the neck. and a natural curve at the upper back, which is a little bit of a kyphosis, but nothing dramatic that's going to drive the head and neck position. His nose is level with the floor. This is a very neutral position that's going to preserve the tissues of your neck and make them healthy. So keep in mind, you do not want to stand with forward head posture. If you feel that you're sinking into that position, you need to change to a very supported, very well thought through sitting desk situation, or move around. Straighten your spine. You're getting fatigued. Don't let your body start collapsing to the point where you can't hold yourself in an upright posture anymore. It's time to stop standing if you find yourself in that forward head position. The final position is the position of rotation, and rotation twists and affects the spine. Before I talk specifically about each picture, let me show you how rotation affects your spine specifically. So to illustrate what happens when your body stands in a rotated position, this is the head, and I'm turning the head as though the eyes are looking toward my right. Okay, and then the pelvis, if your feet are facing in the opposite direction, what we get is this twisting force on the spine. So it's almost like wringing out a washcloth, that there's this very powerful twisting motion that the spine is subjected to. You want to avoid that. You want the pelvis to be pointed in the same direction that your eyes are looking, so your spine falls in one neutral line. That means that the vertebrae and the discs aren't being rotated and twisted, and they can line up to support your posture and your body weight. So imagine that these two metal pieces are vertebrae, and you've got a disc that's in between. If I take these vertebrae and I rotate them, that means the top one goes in one direction, the bottom one goes in the other. That creates what's called a shear force on the disc that's in between. If I let these rest together, that shear force compresses and basically shreds the disc that's in between those vertebrae. That's what happens when you stand with your pelvis and your hips turned one direction and you're looking with your shoulders turned in the other direction. You force these vertebrae, not just at your lower back, but at your neck and upper back, to turn, which creates shear, a shredding force on your discs. You want to avoid that position as much as possible. Line your body up so you don't assume a position of rotation. In this picture, I've set up two monitors because I think that might encourage a rotation direction, that you might start working on something or pay attention and focus to something that's happening on one monitor, and then you might arrange your body to look or use the other monitor without actually aligning yourself to use that second monitor. So in this first example, I'm standing and I'm looking at the monitor to my right. My pelvis and hips are turned to the left as well as my feet, okay? And then there's a bit of a rotation that happens through the upper body. Where that creates stress and where that rotation is focused is right here. That's where things are spinning, just like I demonstrated in the model, that the vertebrae start to rotate in that position. And the middle picture is a very similar posture. It's just that I've arranged myself where I can kind of relax, and actually I have more weight on this hip, similar to the standing on one hip position that we've covered earlier. My feet are facing in a direction that's opposite to my head position and the screen that I'm focusing on. My hips and pelvis are turned to the left. Shoulders and chest are turned to the right. And again, where we get rotation, where we're getting this stress, is right through here. In this third position, again, I'm looking at one screen. My pelvis and my feet and even my knees are turned in the opposite direction, and I'm subjecting my spine to a rotational force. And the neck as well. On all of these pictures, the neck is experiencing rotation as well. If we look at the next set of rotation pictures, in this first picture, I'm not looking too bad. My feet are facing relatively forward. My pelvis is relatively level here. Shoulders are level. My head and neck are rotated toward the screen to the right. And that's because my body's facing forward, but I'm looking at the screen that's to my right, so I have to turn my head. And where the most stress is going to be focused is back here at the back of the neck. In the center picture, what has happened, and this is an illustration that I wanted to create because this might be something that's very easy to do, it just sneaks up on you, is that the keyboard is left in front of a monitor that I had been working on. And then suddenly I'm working on this monitor over here. So what do? I leave my keyboard toward the screen on the right. I turn my feet and pelvis. I turn my head, but my shoulders are staying in the center. And guess what we get? We get this strain and rotation down here through the lumbar spine, the lower lumbar spine. And also get a pull here at this shoulder because that arm is pulling and reaching across my body in order to reach the keyboard on the opposite side. So in picture number 3, I have it set up correctly. Feet are facing the monitor. I am directly facing the monitor that I'm working on. My shoulders are level, pelvis is level, and I have the keyboard directly in front of me. That's the way you want to work on 2 monitors if you can, especially if you're directing most of your attention toward one. And if you are working on one specifically for a period of time rather than really keeping an eye on both of them, you want to turn and face that monitor rather than sustaining a position of rotation. So the purpose of this video was to give you some illustrations of common standing postures that can eventually lead to wear and tear and tissue damage. What you want to do is you want to examine your own standing postures and maybe have somebody take an unexpected picture of you while you're using your standing desk or your standing station and see what your body falls into naturally. See what your relaxed standing habits are. If you spend a significant amount of time in one position, you may be contributing to long-term problems and pain or dysfunction. By no means did I give a comprehensive, all-encompassing example of every posture that someone can shift their body into while they're standing. But hopefully the points in this video have given you the concepts that the body likes to relax. It's very good at finding relaxed positions, whether we're standing or we're sitting, and that you have to be attentive to use good alignment while you're standing. Your body will reach a point of fatigue, and you won't be able to oppose the position that your body wants to shift into for relief. That's the time to move out of your standing position, potentially switch to a seated position, or ideally get some movement. Go for a walk, get a snack, take the dog for a walk, something where you're actually moving rather than staying in a static position. If you use these guidelines and you support your body, you should be able to successfully use a standing desk for part of your workday. Good luck.